Thank you so much for sticking around. Well, continuing conversations about health. While physical health is important, mental health is also vital. I am now joined by Dr. Alan Metley of VitaFuse to share insight about the benefits of ketamine treatment. So Thank you so much for joining me. Welcome to Town and Country again.
Thanks for having me. I appreciate it.
Awesome. All right, so we're here to talk about this treatment. First of all, what exactly is that?
So ketamine is a drug that's been around since the 1960s. It was first developed as an anesthetic for surgery, but really in the past 5 to 10 years, it's really been shown the great benefits for treatment of anxiety, depression, PTSD, and even OCD.
Gotcha. And so how does this treatment work?
So the typical treatment is it's given over 6 infusion series to be done twice a week for 3 weeks. It takes about an hour. And ketamine works really uniquely in that, one, it allows the brain to kind of create new neural connections, which is one way we think it helps with depression and anxiety. It also lowers overall brain inflammation, which plays an important role in depression and anxiety.
Gotcha. And so what patients would you say do you recommend for this treatment?
Sure. Well, as you know, about 30% of the population struggles with depression and anxiety, and a lot of those patients have tried other therapies, whether it be the typical Zoloft or Paxil, or they've tried other drugs that just either didn't work or they couldn't tolerate the side effects. And so ketamine offers that benefit of another treatment option, and unlike other medications, there's no delay in a benefit. So if you start traditional therapy, most people would get benefit in 4 to 6 weeks. The advantage of ketamine is generally within 12 to 72 hours.
Gotcha. And so and that leads me to my next question. How many sessions would you say are beneficial to see results?
So people see benefit generally after the first infusion, but the standard of care currently is 6 infusions done twice a week over 3 weeks. So 6 infusions total.
All right. So I told you off record, sometimes I'm a little afraid about the needles. So can you talk to our viewers and kind of give them some ease as they, go into the session with you?
Sure. It's we try to create a very calming environment. You can sit in your private room, sit there nice, relax in a recliner. It obviously involves an IV. There is a small little stick there, but we have some of the best nurses on the planet. They do a fantastic job. And so most people don't even feel the IV stick. If they do, they feel a little prick, 1 second, 2 seconds. It's over. Like most of the things, it's the fear of it that gets people. And then most people say, well, I didn't hurt at all. And they realize that they worried about nothing.
Gotcha. And so what have you seen, just from your patients from ketamine, what have you seen has been the most beneficial while taking this? We've
had a lot of people that said that they just have not been able to function. They've had trouble getting out of bed or trouble just doing their daily routines. And they've been compliant with the medication. They're just not getting a benefit. And so people have described it as seeing life for the first time in color. Wow. They've been living in black and white, and after a couple of infusions, they said life seems like it's in color. And that's kind of a cool thing to be able to offer someone that's struggled with this disease for so many years, have tried so many things, and have the ability to provide them with this new therapy is really rewarding.
Gotcha. All right, and so what about the IV infusions, the liquid IV?
Yeah.
Can we talk a little bit about
that?
Sure.
It is hot outside.
Yeah.
There's definitely, so we offer 13 different vitamin infusions, everything from just regular saline if you're dehydrated to recovery packages if you're an athlete. Unfortunately, COVID is still popping up a little bit, so we have some COVID patients that are coming in just for not feeling well, for kind of nausea, vomiting, dehydration. So we have a full range of IV infusions for whatever you need.
Gotcha. And so what type of vitamins are in the IV?
Yeah, so most of our vitamins are a full complement. We have full complement of B vitamins, we have magnesium, we'll also add things like glutathione, which is an anti-inflammatory, vitamin C, B12. So depending on the infusions, we've also got some that have a kind of a proprietary blend of amino acids, depending on what you're looking for. So whatever you need, if you tell us kind of what you're looking for, either myself or the nurses can kind of guide you toward the right infusion that's going to benefit you the most.
Gotcha. Well, I know it's beneficial because I have my coworkers here talk about it all the time. All the time they're talking about liquid IVs. So I definitely have to make a trip down there to try it out.
Love to have you.
Awesome. Well, tell us where we can go ahead and find you and learn more information.
Sure. You can check us out at vitafuse.com, or you can give us a call here in Albany at 229-405-1088.
Perfect. Well, thank you, Dr. Metley, for joining us and
Thanks
giving us the inside of the treatment that's literally changing lives.
Absolutely.
Awesome. We're going to take a quick break, but